What's the best way to learn? I think the best way to learn is a combination of these 3 or 4 things. One is continue to read the literature. 2, I think enrolling in hands-on courses where you can actually do the procedures. 3, try new things, but do so in a controlled manner. My biggest strength as an educator. I think my biggest strength as an educator probably is my ability to listen to the people in the class and acknowledge their experience level, and also just the experiences that they've had, and try to help them figure out ways to break down barriers and learn new things. Boy, why do I love what I do? You know, it's funny, I ask myself that every day, and partly because as time goes on, you start thinking about what the exit looks like. Honestly, I have a hard time looking at the exit because I enjoy taking care of my patients, seeing the changes in their smile and the changes in their lives, helping them solve their problems. Those things are still so exciting to me that I think not taking care of my patients and continuing my education would probably leave a major void in my life. What advice would I give my young self? Rather than stress out about the little things, continue to do what I was trained to do and understand that at the end of the day, everything will be okay. What do I think is most overlooked by new doctors from an educational standpoint? I think new doctors are maybe more reluctant for in-person education, or wanting to take that time off and out of their practice in order to continue to educate themselves. I don't think that you can gain the same level of education through online offerings, although I do think they have great value. I would tell them to take the time off and invest in themselves and go to these in-person courses, because I think some of the knowledge that you gain from the conversations with those who are also there with you is invaluable and impossible to get in any other way. What excites me and what worries me about the future of my profession. What excites me about it is just the rapid change in technologies, the different procedures that are available to us now that weren't before. I find that to be invigorating and exciting. But I am concerned that I think that all of dentistry is becoming diluted. I feel that that we should stick with what we're good at and refer what we're not good at. And I think that would probably benefit everybody. If I was going to train as in a different specialty in dentistry other than prosthodontics, what would I train in and why? Wow, I'd probably train in oral surgery. I think originally I wanted to go into oral surgery, but at that time decided I didn't like extracting teeth. But from what I can see that they can provide for patients now, it's such a different world. And I think that actually the combination of oral surgery and prosthodontics is, pretty solid. But I think that oral surgery would have been a good choice.